looking forward, so we share with you the principles of value-based healthcare and when does it apply and when does it not apply. So to take a conscious decision and also what can help you in that decision, looking at the applicability of outcomes measurement versus how the care is organized, whether it should integrate or coordinate, and whether it's integration or coordination that leads to faster results or measurements or both. I now quickly want to look forward and say, okay, what does this all tell us looking forward? And I want to start with the notion that we have an ever increasing elderly population. And there immediately, of course, you see that this population is comorbid, heterogenic, and therefore not really fit for pure value-based healthcare. You see the graph on the right that comorbidities rise with age. So that means that there is no single unambiguous care process, first and for all. So they're all in a network with multiple diseases. So Parkinson itself is already, let's say, multifactorial, multidisciplinary, but on top of that, elderly patients can have other diseases like diabetes or orthopedic, require orthopedic surgery or whatever, right? And these all need to add up to relevant patient quality of life. So if you look then also to the standards that are set by ICHOM, the Institute for Outcomes Measurement, they defined the standard set for older persons, but there what you see are holistic outcomes that are not linked to a specific intervention, so only holistic outcomes. So it's very hard to relate them to the interventions that are being made in this, let's say, organic patient journey, which means that we are wasting scarce resources because a lot of people with multiple diseases, chronic diseases and elderly patients, they are in a job shop model without coordination, which leads to undertreatment, overtreatment, miscommunication and errors. And therefore, it's a very inefficient system that we can no longer afford, especially with this growing elder population. And also combined with COVID, you see there that COVID is bringing an additional complexity and putting more stress on the system. And some people say infectious diseases are here to stay. So we really need to be very effective with our scarce healthcare resources and the way we deliver care. So if we cannot integrate, we must coordinate. And moving from an organic job shop care delivery model to a coordinated hub and spoke model. And there were some questions already I saw, how do you need to do that? And I come to that in the final section before the Q&A, directly after the second panel discussion, what is needed for that. So the point here is that you proactively manage care delivery towards patient-relevant outcome. Like Teus said, you need to understand what is relevant for the patient, and then you steer the patient to the right medical professional or care provider. So instead of measuring in retrospection. So it's a virtual practice network instead of an integrated practice unit, and therefore value-managed healthcare instead of value-based healthcare. So value-based healthcare applies the principles of value-based healthcare, but you cannot apply them in a very mechanic and in a theoretical way as it has been described. Well, if you do this for one disease, the ultimate solution is then that you do that for multiple diseases. So you could have, let's say, Punt for Parkinson that Teus is running at the moment around Parkinson disease. But this older person also might need a hip replacement that is organized according to the line model. And to get to best outcome, you need to understand what is relevant for the patient and how you coordinate this patient towards relevant care, and also keep track of what is happening to this patient so that they don't fall between the cracks. Because now we are basically depending on the patient that and with his direct relatives or family, that they are able to have the oversight and come to the right decisions. But that's not the case, especially if you're very sick. right? So in elderly care, significant value can be created with value managed healthcare, and I think Punt for Parkinson is a clear example of that. So you can clearly see the savings that you can make, but the problem there is that the reimbursement system is not rewarding that because of the silos. So that is something we need to solve also, that we look holistically at care and that we integrate care and use the right IT systems there to support it, of course. So a lot of things still to be done, and we need to do this together. So it's about making the invisible visible through proper coordination of care and steer towards relevant patient-agreed outcomes, putting the patient centric. Then the second point is how to apply value-based healthcare within an increasing outcomes-driven pharma industry, right? They are more and more need to show the evidence of their efficacy, and people want to understand what the pharma companies bring. And I think Janneke clearly outlined there's a lot of value that pharma can bring, but we need to make it transparent. And it brings us to the point, to what extent can pharma take responsibility for patient-relevant outcome, which is not a straightforward thing. Because if you look at the pharmaceutical intervention, which is in a way a routine intervention, because it's a very standardized, clearly defined intervention for a very targeted patient group, very well described as part of the label. The question is, how can pharma take final accountability for the patient outcome in this complex care setting, because there are so many factors at play here. So we gave that some thought, and there is, let's say, the most simple situation would be that pharma is the only preventive or therapeutic intervention. And there are not a lot of examples there, but there are a few examples, for example, in hematology, that pharma is indeed the only intervention. Well, then it's very easy, of course, to say, okay, we take responsibility and accountability for the patient outcome, although there are more factors coming to play there, but I will show in a minute. Then in a more complex setting, then it becomes, of course, also more complex to take accountability for outcomes and control them as a pharma company. So it could be that the pharma intervention is taking place within a controlled, integrated care pathway in a line model. Well, there, since it's such a, let's say, care delivery under clear conditions, there is a possibility, of course, in cooperation with other care providers, that pharma takes co-accountability for the patient outcome. Or, and that's an easier situation, that pharma is at the end of a complex care pathway, where you say, okay, I now will take care of the patient to maintain his status, secondary prevention, for example, where you say, okay, I understand the patient's status, and I will take responsibility as pharma to optimally maintain the quality of life of this patient and take accountability for it. But here, it's very important also here, it's not one story fits all. For pharma, you need to look, where do I intervene and where can I take accountability for the outcome. So there are some additional conditions. So once you decide it makes sense to measure these outcomes, there are a few extra things, extra conditions that come into play. For example, the first one is that you need, in a complex setting, cross-disciplinary collaboration and ownership regarding the patient outcomes, because pharma is not the only intervention. You need to be very clear how you partner up with other care providers and sometimes payers also, to say, okay, what is our joint responsibility and how does this translate then to individual responsibilities? Secondly, you need to have insight in the care process from intake to aftercare to be really sure what is the patient mix, where do I intervene, and you need to have insight in the total care process and be able to measure, let's say, the different parameters. There should also be, of course, a clear understanding how pharma is influencing the patient outcome, which is also not always a direct correlation. So you need to sometimes invest in a better understanding of how the pharma intervention is influencing the patient outcome. And lastly, it has been mentioned before, you need to have integrated infrastructure for data registration, processing, and data access, of course, to understand what you are doing as a pharma company and to take accountability there. So there's a lot of things that come into play, and sometimes it's better to say, okay, I'm not taking responsibility for the patient outcome as pharma, but I'm taking responsibility for an interim result, which is of course suboptimal. But as an alternative, pharma could consider a surrogate outcome. So that's an outcome of which you know that it has a huge correlation with patient relevant outcomes. So it's an interim kind of measurement, or the more simple binary, let's say patient response, non-response measurement. So is the patient indeed reacting to the pharmaceutical therapy? Then lastly, what is I want to bring to the table that for pharma, value-based healthcare triggers also an important strategic choice and also a definition of the role that they want to play in the healthcare system. So it is first of all in the area of outcomes measurement. Do I want to measure a real patient outcome? Do I go all the way? I'm the only intervention? Am I in a controlled setting, or am I in a complex setting? And is that not possible for me? Should I go for a surrogate outcome? And to what extent do I want to set outcomes standards around this specific treatment, and maybe even define a standardized data set for that is then filed at ICHL? Yeah? So what is the role you want to play? And also, how does it link to the company that I want to be in the healthcare system? Linked to that even more is the improving and integrating of care. So am I there to co-develop care optimization solutions? So there you move from, let's say, product supplier to, let's say, healthcare partner with your other healthcare stakeholders. So do I play a role in improving care? Do I want to be a constant partner in continuous care improvement? Or do I even go a step further where I develop or acquire disease management services? So I'm moving forward even in delivering certain care solutions in the whole healthcare ecosystem. So that's quite some conscious choices that a pharma company has to make, that has a direct link with the company strategy and the role that you want to have in the healthcare system. And then lastly, I think an important notion is that pharma also has another way of putting the patient at the center beyond value-based healthcare. So to what extent do you move to patient lifecycle management instead of product lifecycle management? And so do I take the full patient cycle into scope, including maybe prevention, aftercare? So how broad is my role looking at the total patient care pathway, the patient life cycle? And also, I think there's a direct impact that pharma can make is by patient co-creation along the product life cycle, by involving patients already when new pharmaceutical products are developed. So have a more patient engagement in the R&D process. So I think there are different dimensions that the pharma company can play to put the patient at the center.